Clearly, we have an increasing rate of deaths, but I am told that emergency room admissions are beginning to decrease. Hopefully, that is the kind of the breaking of the wave, and although we know that ICUs will continue to be full for a while, if we have decreased admissions, hopefully that means decreased transmission. Yeah, so what I propose is that we set up something, an immunity registry, if you will, similar to what we have now for immunizations. When a child is immunized, since about 1994 or 95, these have been set up. When a child is immunized as a one week old for hepatitis B, measles, etc., it's put into the registry. When they're again vaccinated at 11, that is put into the registry. And when they're vaccinated at 17 going off to college, again put into the registry. So then 10 years later, when they're going to medical school or nursing school, joining the military, etc., you can pull that from that online registry, have it documented, and you do not need to revaccinate. It all is compliant with privacy, with HIPAA, with privacy concerns, and it provides a legacy documentation. If we think about the coronavirus, we know, or we strongly suspect, that once somebody has been infected, they are now immune. That immunity would allow them to return to work. If they're a nurse, to go in without PPE to see a patient, a routine patient with coronavirus infection. Somebody working in a store would not have to fear being infected or infecting others if we knew she was immune. And so you not only know this on an individual level, but as that excerpt you mentioned, you can also know on a community level when you have a certain level of immunity that allows a freer society. We need this information. It would allow people to return to work, to be comfortable that they won't get infected if they go to the grocery store, etc. It doesn't, but the best evidence seems to be pointing in that direction. And when Fauci and Birx in their public briefings speak of herd immunity, implicitly they are saying that they think the antibodies or previous exposure is helpful. There was just an article in The Lancet, the British medical journal, quoting somebody who's worked with SARS. SARS is a virus, a coronavirus, just a different coronavirus. And he speaks about the immunity to SARS lasting for quite some time. And so there is gathering evidence that's probably the case. In the meantime, we need to stand up the registry so that if it is true, we've documented it and people can return to commerce and to education. There is a little bit of evidence from China that 5% of patients or so who have cleared the infection or stopped having symptoms continue to shed virus. It is unclear whether that is true or whether that was just a faulty PCR test, but nonetheless, if we say that 95% of people are immune, even if another person is spewing virus, it would mean that the 95% of people are immune. I will concede there's uncertainty here, but if we wait for absolute certainty, our economy is going to be in the tank. So there's going to be a trade-off between absolute certainty on the medical aspect and opening up education and the economy for society to continue to flourish. So absolutely not. We already know from immunization registries that we can preserve privacy. And it would be akin, if you will, to hospitals currently requiring all employees to have the flu vaccine. Well, they may decide if you work in certain areas, you must be immune to the coronavirus. We have a well set of laws established in this, both to protect privacy as also to protect individuals.